Hello, everyone. My name is Brandon Delgado. This is my group members Pedro, Doyen, Paulo, Sebastian, Sam, Tanya, Yalitza, Cameron, and Luz. And today we're doing our presentation on PTSD, and the movie that we chose was American Sniper. All right, so for the table of contents, just an overview. We're going to begin with an overview of PTSD, move on to the impact, stress factors, development, nursing process, and social implications. All right, so I'll begin discussing our disorder is PTSD or post-traumatic stress disorder. The etiology, so based in this film, it stems from exposure to traumatic events during Chris Kyle's military experience. During his service in the military, he witnessed violence, took people's lives, and had to face internal moral conflicts. Moving on to neurophysiology, PTSD is associated with alterations in the brain regions such as the amygdala, hippocampus, and medial prefrontal cortex. So the lasting effects of trauma on the brain show long-term dysregulation of norepinephrine and cortisol, which leaves the person in a state of fight or flight and under immense amounts of stress. In terms of pathophysiology, the dysregulation of the hypothalamic pituitary adrenal axis leads to abnormal cortisol levels, and this chronic stress causes neurochemical changes, including alterations to norepinephrine and serotonin levels. This leads to hyperarousal, intrusive memories, and avoidance behaviors. Moving on to therapeutic measures. So this includes psychotherapy, non-pharmacological interventions, and pharmacological interventions. So to begin with psychotherapy, we have exposure therapy, which is a behavioral therapy that helps the patient safely face situations and memories which they find frightening, so they are able to cope with them. Cognitive therapy is a talk therapy that helps the patient see their cognitive patterns that are keeping them stuck. In terms of non-pharmacological interventions, we have coping strategies, breathing techniques, spending time with family and friends, and owning pets. In terms of pharmacological interventions, we have antidepressants such as SSRIs. They include sertraline or Zoloft and paroxetine or Paxil, and these are approved by the FDA to treat PTSD. In terms of anti-anxiety medications, we have lorazepam or Ativan, and then there's also research about this stellate ganglion block. This is a procedure that involves injecting medication into a collection of nerves on the side of the neck, and it shows promising results to treat PTSD. And then another medication is prazosin or Minipress, which is used to treat high blood pressure, but studies show it may reduce or suppress nightmares for those with PTSD. Okay, and then in terms of the DSM-5, the criteria is very extensive. It has A to H. So beginning with A, the person has to be exposed to death, threatened by death, actual or threatened serious injury, or threatened sexual violence. For B, the traumatic event is persistently re-experienced by unwanted memories, nightmares, flashbacks, emotional, physical reactivity after exposure. C, avoidance of traumatic related stimuli after the trauma, so trauma-related thoughts or feelings or trauma-related reminders. For D, negative thoughts or feelings that began or worsened after the trauma. So it's an inability to recall key features of trauma, overly negative thoughts of oneself or the world, feeling isolated, and difficulty expressing positive affect. For E, the trauma-related arousal and reactivity that began or worsened after the trauma. And this includes irritability, risky or destructive behavior, hypervigilance, heightened startle reaction, difficulty concentrating, difficulty sleeping. For F, the symptoms last more than 1 month. G, the symptoms create distress or functional impairment. And H, symptoms are not due to medication, substance abuse, or other illness. And throughout the film, we see Chris Kyle experiences all these criteria, and he meets all the criteria that relates to PTSD. And then here's just a movie clip that shows.
Hey, Chris. Babe. And I'm going outside.
Well, my name is Pedro Gonzalez, and I will be presenting the NCLEX style questions. Our first question is, a nurse is educating a group of veterans about the signs and symptoms of PTSD. Which symptoms should the nurse include that is commonly associated with PTSD? And the correct answer is heightened startled response and hypervigilance.
Okay, my name is Paulo Manzano, and I'll be presenting the institutional legal healthcare policies, regulations, clients' rights, ethical standards, care diversity for veterans with PTSD. So starting off with the institutional legal healthcare policies, certain policies determine the availability of mental health resources to treat war veterans with PTSD. Poor implementation of these policies may result in barriers to providing proper care, such as long wait times and reduced quality of care. Institutions that adopt an integrated style of care involving collaboration of various healthcare professionals from different disciplines can better meet the sophisticated needs for veterans and essential to providing quality care. And for clients' rights, like all clients, war veterans like Chris Kyle who suffer from PTSD have the right to be informed about the options for their treatment, which includes therapy and the type of medication administered. Autonomy should be emphasized for all clients. Safeguarding privacy is also very important. Patient information should be protected in order to build trust, especially for someone dealing with sensitive issues. And for the economic part of it, funding for programs for war veterans for their treatment has always been poor, such as the Veterans Health Administration. Therefore, it limits the availability for quality treatment and mental health services. And finally, for the ethical standards and cultural care diversity, cultural diversity must be acknowledged. Recognizing the experiences and perspectives of veterans helps tailor care. Military culture can influence attitudes towards seeking help, and addressing these cultural factors can reduce stigma and encourage veterans like Chris to pursue the necessary mental health support that they need.
This is Luz, and I'm going to be doing stressors and factors. Some stressors that relate to PTSD are family. Chris grew up with a strict and authoritarian father. Also, death. Chris was exposed to a lot of death. Being in the field, the environment you're in is a big factor. Being deployed in a dangerous environment puts a lot of stress on the mind. Major life changes, going from being a cowboy to fighting for your life on a daily basis is what Chris experienced. And marriage, at one point, Chris had to choose between going back to fight or keeping his marriage. Some safety factors would be physiological, so getting mental help when needed. Chris knew that he needed mental help when he reacted violently at that family barbecue and giving your body the rest it needs. In this case, Chris was overworking himself. He was not letting his body rest, and that could have a toll on his mental health. Moving on to social, coming to terms that getting mental help is good. Chris was a bit hesitant at first to get help, and he didn't think it was that important. But however, after that barbecue incident, he knew he had to change, and he had to make a change to make it work for his family and helping those in need. After getting help, he also helped other veterans who were struggling with their mental health and having a support system. Chris had his buddies who had each other's backs, but however, after seeing the death of a few of them, Chris's mental health started to decline. Moving on to spiritual would be believing in your own values. Chris kind of struggled with this when he had to kill a child. You could see in the movie how hesitant he was to pulling that trigger, although it was the right thing to do. Chris knew that killing a child or killing anybody in general was not something that he enjoyed doing. Finding things that relax your mind. Chris found peace in helping others through shooting at a shooting range, and he used the pastime he enjoyed to connect to veterans that were going through similar situations. Moving on to cultural, one of the big ones was stereotypes. From the beginning, we see that his dad enforced how the boy should act like men and be masculine. So this could have influenced his decision in getting help and not going as soon as he saw symptoms of his mental health worsening. And also being in an environment that brings peace and comfort. We saw how Chris and his family moved back to Texas his home as a way to start fresh in a place he finds comfort in. Some strains of that Chris experienced was that he had a supporting family to come home to. He understood the importance of getting help, and he was able to help other veterans who also struggled after their time away. And some deficits he experienced was that he did not know when to stop. So this eventually affected his marriage because his wife wanted him home after his deployment was over, but he just kept going back. Being in difficult situations that impacted his mental health. He struggled when it came to killing children because they were just children at the end of the day. And not managing the coping of deaths, Chris had to see a few of his friends die. It would have benefited him to see his mental health if there was like a way for him to get help to cope with the deaths of his friends, but he just kept working.
Okay, for question number 2, we have a nurse is developing a care plan for a soldier returning from deployment with a PTSD diagnosis. Which goal is most appropriate for this client? And the correct answer is the patient will develop coping strategies to manage anxiety and triggers.
Hello, I'm Yelitsa Camarillo, and I'll be discussing Erickson's theory. Erik Erikson was a psychologist who created a theory of psychosocial development. The theory entitles that our personality develops in stages, and at every one of these stages, a psychosocial crisis unfolds in a way that determines our personality development based on the outcomes. The stages that best fit the film is stage 6, intimacy versus isolation, that happens between the ages of 18 to 40 years old, and the conflict centers around forming intimate, loving relationships with other people. So intimacy is the ability to open and share oneself with others, whether that be romantic partners, friends, or family. If it is successful, there is a strong reciprocal relationship, enduring connections, and closeness with others. Whereas isolation deals with individuals unable to form close, meaningful, and intimate relationships due to trauma, stress, anxiety, etc. It often leads to feelings of loneliness and depression. Intimacy is illustrated in Chris's relationship with his wife, Taya, who does her best to understand and support him when he arrives from his 4 war tours. However, Chris had a difficult time engaging and opening up to his wife, as combat contributed to his PTSD and had placed a negative psychological toll that made him disconnect from his family and to the reality around him. In spite of this challenge, the couple managed to sustain and reinforce the relationship after Chris had decided that Tour 4 was his last war and stated that he was ready to come home. Chris allowed vulnerability to be provided with and provide help to those who struggle with PTSD post-war.
Okay, hello, my name is Sam. I'm going to be covering the nursing process, looking at the prioritization and safety concerns of Chris Kyle. So looking at assessment, we can see many physical changes, such as physical injuries during his time serving. He experienced difficulties with sleep, as well as weight loss, fatigue, and just overall changes in physical appearance. We see a large amount of changes in his emotional state or psychological state. We notice that throughout the movie, he's experienced flashbacks, hypervigilance, as well as emotional detachment. Um, we notice that his mood changes. He's struggled with withdrawal from family life, as well as with irritability. And then we also just noticed that overall, he just struggled with the inability to adjust to civilian life. Moving on to diagnosis, these are just some related diagnoses. PTSD, of course, related to his combat experience. His anxiety related to exposure to internal or external cues that symbolize or resemble an aspect of the traumatic event. Ineffective impulse control, and a risk for ineffective relationship. Now, looking at planning, these are just some short-term and long-term goals. Short-term, attend counseling sessions regularly to address and verbalize his PTSD, feelings, and anxiety. We also want to improve his sleep patterns and quality. Looking at long term, we hope that he reconnects with his family and engages in meaningful interactions, develops appropriate coping mechanisms, and reintegrates into civilian life. For implementation, these are just some plans, such as psychotherapy or cognitive behavior therapy, medication management, such as antidepressants or anxiolytics, such as Ativan, family counseling, and mindfulness techniques, which are coping mechanisms, such as relaxation techniques, including yoga and meditation. To evaluate his plan of care, we want to look at, is there improvements in managing his PTSD symptoms? How are his sleep patterns? Is it consistent? Is it improving? Interaction with his family, as well as his reintegration into civilian life.
Hi, my name is Cameron McKay, and I'm going to be presenting the client-centered care plan. First off, we have the nursing diagnoses of death anxiety related to psychological distress associated with a traumatic event, post-trauma syndrome related to exposure to a traumatic event, and risk for self or other directed violence related to psychological distress associated with traumatic event. So the short-term goal for the first one would be the client will be able to identify support systems and available resources and be able to connect with them by the end of the shift. I did a couple of long-term ones for this section as well. So long-term, the client will be able to return to pre-trauma level of functioning as quickly as possible. The short-term goal for the second nursing diagnosis is the client will be able to acknowledge traumatic event and begin to work with the trauma by talking about the experience and expressing feelings of fear, anger, anxiety, guilt, and helplessness by the end of the month. Long-term goal for this diagnosis is client will be able to assimilate event and move forward to set and pursue life goals by the end of the treatment. The short-term goal for the third nursing diagnosis is the client will be able to return to and strengthen coping mechanisms used in previous traumatic event by the end of the second month. And long-term goal for this would be client will be able to acknowledge event and perceive it without distortions after 4 months. So these goals were set because death anxiety, in the movie, Chris Kyle demonstrates feeling guilt over and blaming himself for the deaths of his squad mates, even though he had no control over that, and proceeded to then insist being on the ground with them instead of covering them from the sky. So he experienced a lot of anxiety over these deaths and losses. He also has a lot of PTSD seen throughout the movie where he's zoning out and just reliving these experiences, and risk for self or other directed violence. During one of the scenes, he was seen he was going after a dog because his brain had interpreted it as a attack, but it was just a dog playing with a child, and he reacted and was able to be called out of it by his wife. So the interventions for for this care plan would be to help the client use positive cognitive restructuring to reestablish feelings of self-worth, refer the client to peer support groups, assess the influence of cultural beliefs, norms, and values on the client's ability to cope with a traumatic experience, encourage the client to return to his or her normal routine as quickly as possible, talk to and assess the client's social support after a traumatic event, teach stress reduction methods such as deep breathing, visualization, meditation, and physical exercise, encourage their use, especially when intrusive thoughts or flashbacks occur. Oh, it switched on me. 1 second. Assess the effect of the trauma on family and significant others and provide empathy and caring to them. Remain with the client and provide support during periods of overwhelming emotions. Refer for appropriate psychotherapy, cognitive therapy, exposure therapy, eye movement desensitization, and reprocessing and cognitive behavioral therapy. So my rationale for these would be, it was shown that cognition therapy was well tolerated and led to a very large improvement in PTSD symptoms, depression, and anxiety. Most clients showed reliable improvement that was clinically significant. Public stereotypes affect help seeking, at least early in the course of illness. Peer-based outreach and therapy groups may help veterans engage in treatment and resist stigma. The effectiveness of psychological therapeutic treatments depends on the client's beliefs. It is important to gather this information to create a care plan that the client is willing to participate in. This also facilitates patient advocacy and autonomy because it involves them in creating their treatment plan and is catered to their personal beliefs and needs. For families following an intensive care unit admission, written information about possible psychological sequelae and psychological follow-up was found to be preferable, complemented by telephone support and guidance. Given the high number of physical, mental, and social problems in trauma clients, identifying and strengthening support sources can be effective in the adaptation of the effects of an amputation on an individual and improvement of the quality of their life. It is also explored that the efficacy of private meditation-based mantra intervention for veterans to enhance spiritual well-being in outpatient veterans diagnosed with military-related PTSD. It was also explored the efficacy of private meditation. I have that doubled, so I'll have to fix that. The Donaldson Artisan affirmed that nurses must continuously assess and reevaluate the needs of patients and the patient's loved ones during a traumatic event and provide essential emotional and social support as needed. It was also studied the effects of intervention for female victims of intimate partner violence on perceived social support and found overall aim of the stabilization part of this treatment was to provide the woman with a sense of control over her physical safety and her psychological and social situation. These approaches can help the client gain control of the fear and distress that occur after a traumatic event. And it was confirmed that EDMR significantly reduces the symptoms of PTSD. So Chris Kyle was basically, he suffered from a lot of PTSD, and group therapy seemed to help him the most because he was very big on being there for his squad mates. And so, like, towards the end of the movie, it shows him, basically engaging in his own therapy by providing therapy for others, and that just kind of helped bring him back to the real world instead of the his war version where he was just kind of stuck at, and that was seen each and every time he came home up until the point where he stayed home. And that is it for my portion of the project.
Okay, for our third question, we have a nurse is educating the family of a veteran with PTSD about common triggers. Which example should the nurse provide that illustrates a potential trigger? And the correct answer is loud noises such as fireworks or car backfires.
All right, my name is Sebastian, and I'll be looking at the society's viewpoint on PTSD and just like the stigma around it in general. So typically, society views individuals with PTSD as violent and dangerous to others, but in reality, they're of more of a danger to themselves. They're at risk for hurting themselves, and then PTSD is also at risk for suicide. And then, so many view the military as being like extremely tough and resilient, which is like super common. But this portrayal can discourage those who are seeking help. And then within society, they may be viewed as weak within like the military realm. So this was kind of like common in the film, as Chris Kyle was denying any form of treatment until after the third deployment, where he called his wife saying that he needed help, and then also like when he attacked the dog, that's when he kind of decided to get help as well. So many individuals believe PTSD only comes from combat, but it can also stem from many stressful situations in life. And then finally, Those with PTSD may have a strain in their relationships, and then this can further increase their maladaptive practices, such as drinking and smoking. And then also these strained relationships can impact those seeking help. So if they don't have good relationships, they may not get help. That's it for me.
Hello, this is Tanya, and I'll be presenting PTSD's presentation through Chris Kyle's experience. PTSD manifests itself differently in every person, but specifically for Chris Kyle, he presented it with recurrent, involuntary, and intrusive recollections of the event. That stimuli leads to arousal and reactive externalizing symptoms and dissociative symptoms, according to the American Psychiatry Association. This is also known as a DSM-5. Yeah. So this to say, when Chris was put in scenarios that resembled in the slightest on-ground war experiences, regardless of how harmless it was, he would react to it as if it were a life or death situation. One such example was when he was unable to save a father and son duo in Iraq from the butcher, whereby the son died from a drill to the head. That day, the drill and the wailing from the child haunted him into two separate events in the future, both involving his kids. One occurred when he was at a mechanic shop with his son, and upon hearing a drill go off, he became physically distressed and protective over his son. The second time he heard those same cries were from his newborn daughter, to which he began to bang on the windows of the nursery and screamed at the nurse to tend to his daughter. Then his dissociative symptoms began to manifest themselves towards the end of the movie when he was sitting in front of the TV screen, nothing playing, yet he was reliving the wartime events he had experienced, which inevitably translated to him right after almost hurting a dog who was innocently playing with his son. Another way PTSD manifested itself is through vitals, according to the Lippincott book. Chris consciously decided to not pass on his traumatic experiences to his wife, so he internalized everything that happened to him, inevitably playing itself through his blood pressure. During the first prenatal visit he had with his wife with their firstborn son, his wife plotted with the doctor to check his blood pressure since he wasn't opening up to her about his struggles, and his blood pressure reading was 170 over 110, nearing a hypertensive crisis despite being safe from harm, but unfortunately his traumas would keep him on high alert. All this to say, everything I've read about has been congruent to what Chris Kyle lived through with PTSD, but I have yet to see it real life at the VA.
Hello, this is Doyan, and this is an evaluation of the experience. Watching American Sniper was a very useful experience for going a deeper understanding of PTSD, particularly in the context of military service. The film follows the life of Chris Kyle, a Navy SEAL sniper, and depicts the immense psychological struggles he faces both during and after his time in combat. One of the key takeaways from the movie is how it highlights the emotional and mental toll that war takes on soldiers. Chris Kyle experiences symptoms commonly associated with PTSD, such as heightened anxiety, hypervigilance, hypervigilance, and flashbacks and difficulties reintegrating into civilian life. The film also explores how PTSD affects not only the individual, but their family and close relationship as well, making a comprehensive portrayal of the disorder. From the educational perspective, I found the movie to be a valuable tool for understanding the real life impact of PTSD. It brings the uh, theoretical aspects of the disorder to life by showing how deeply trauma can affect a person's behavior, emotions, and ability to function in everyday situation. For someone studying psychology, mental health, or nursing, particularly in the context of trauma or military service, American Sniper could be highly beneficial. I would recommend this film to others who are looking to explore the psychological consequences of war, especially those focusing on mental health disorders like PTSD. It could also be helpful for individuals who work in fields related to veterans care, or trauma therapy, as it offers insight into the personal struggles many veterans face. However, I would be cautious when recommending it to someone with personal trauma, as the movie contains intense and potentially triggering scenes. Overall, American Sniper provides an emotional and powerful portrayal of PTSD, making it useful for both educational and personal exploration of the subject. And thank you.
Okay. For our final question, a veteran participating in a support group shares feelings of loneliness despite being surrounded by family and friends. What is the most therapeutic response by the nurse? Oh, the correct answer is it sounds like you're really struggling with these feelings. Can you tell me more? And that is the conclusion of our presentation. Thank you for listening.